Hello everyone, my name is Amnisha Hera binti Haji Bahrom, a pharmacy student from Institute of Health Sciences, University Brunei Darussalam. Today, I will be talking about hemorrhoids. What are hemorrhoids? Hemorrhoids or buwasir are swollen veins or lumps in the lowest part of the rectum and anus. There are two types of hemorrhoids, internal hemorrhoid and external hemorrhoid. Internal hemorrhoids lie inside the rectum and usually do not cause any pain, while external hemorrhoids lie under the skin around the anus and can itch or bleed when irritated. The internal hemorrhoids can be further divided into 4 degrees. First degree, bleed a little when passing a stool but no prolapse. Second degree, bleed and prolapse that return inside the anus on its own after every bowel movement. Third degree, prolapse and physically push lumps back inside the anus after passing a stool. And fourth degree, prolapse that cannot be pushed back inside. Hemorrhoids is one of the most common ailments affecting up to 50% of people at least once in their lifetime. In New Zealand, it is reported that from the year 2007 to 2016, there is an increase in the incidence rate of symptomatic hemorrhoids from 84.6 to 120.5 per 100,000. Now, we'll move to causes and risk factors of hemorrhoids. The exact cause of hemorrhoids is unclear, but they are related to an increased pressure in the blood vessels in and around your lower rectum, causing the blood vessels in your back passage become inflamed and swollen. The most common cause of hemorrhoids is too much straining during bowel movement because of constipation. Hemorrhoids can be also due to the following reasons. Aging. It is known that prevalence increases with age and highest between 40 and 65 years old. Pregnant women is more likely to experience hemorrhoids than non-pregnant women. This is due to the pressure on the hemorrhoidal vessels due to the enlarged uterus. The increase in progesterone hormones also tends to cause constipation. Heavy lifting and sitting for a long period of time. Next, symptoms of hemorrhoids. Swelling or soreness around the anus, itching around the anal area, pain when passing a stool, a lump hanging outside the anus, bleeding after passing a stool. The blood usually appears as bright red that may coat the stool, splash around the toilet bowl or stain the toilet paper after passing a stool. Mucus discharge, and feeling that the bowel has not been fully emptied after defecation. Treatment of hemorrhoids can be divided into 2, home or self-treatment, and pharmacological treatment. Sitz bath is one of the effective home treatments for hemorrhoids as it reduces swelling in the anal area. This can be done by soaking the anal area in warm water for 10 to 15 minutes twice or 3 times a day. You can also try to add Epsom salt to the warm water. Epsom salt is made of magnesium sulfate, which can be used as a soaking solution to help reduce swelling, ease pain, and relieve any itching related to hemorrhoids. You can also apply cold compresses or wrap ice packs inside a cloth and apply on the affected area for 15 minutes 3 to 4 times daily to relieve swelling. It is also good for you to practice a good anal hygiene, as presence of small amount of fecal matter can cause itching. Wash with warm water after each bowel movement, as soap tend to dry the skin and will make itching worse. Hemorrhoid symptoms such as mild pain and swelling often resolve after a few days without any treatment, or it can be managed by using some over-the-counter medications. There is a wide range of medicinal products including tablets, cream, ointments, and suppositories which are available without prescriptions for the symptomatic treatment of internal and external hemorrhoids. However, for persistent bleeding, prolapse, and painful hemorrhoids, the doctors might recommend one of the minimally invasive procedures available, such as rubber band ligation, sclerotherapy, and hemorrhoidectomy. There are many over-the-counter ointments for hemorrhoids that are available in health stores, such as Anucare Ointment, Anucare Ointment, and Preparation H Ointment. But today, I will only touch on Anucare Ointment. What is Anucare Ointment for? Anucare Ointment is used for the relief of itching, burning, and soreness of hemorrhoids and minor rectal inflammations and irritation. How to use the Anucare Ointment? You should apply ointment twice daily, morning and night, or after each bowel movement, ensuring area is completely covered. And it is usually used as required basis only and no longer than 7 days. How long does it take to work? It usually takes 5 to 7 days to work depending on the size and severity of hemorrhoids. If you happen to miss the dose, take as soon as you remember unless it is almost the time for the next dose. Remember not to double the doses to make up the missed dose. Store the ointment in an airtight container below 30 degrees Celsius away from light and moisture. Discard after 6 months of opening and keep medicine out of reach of children. Is it safe for pregnant or breastfeeding women to use Anucare Ointment? Use only if the potential benefits of treatments outweighs potential risk, and always consult your doctor before use. Now, I will be showing you the steps to use the Anucare Ointment. Step 1. Wash the anal area and dry gently using a soft towel before applying the medication. Step 2. Unscrew the cap. Step 3. Attach the plastic applicator tip on the tube. Step 4. For internal hemorrhoids, first, squat or lie down on your side with one leg straightened out and the other leg bent towards your stomach. Second, insert tip into the rectum and gently squeeze the tube. Step 4. For external hemorrhoids, apply the ointment to the affected area by using clean hands or gauze dressing. Finally, Step 5. First, after use, wash nozzle in a hot solution of detergent and then thoroughly rinse in clear water. Second, always wash hands before and after using the medication. Side effects and allergies. For side effects, burning or itching of the skin may be experienced which doesn't last for a long time. Allergic reaction to Anucare Ointment is rare. Discontinue the medication if suspected and do not take the medication if you are allergic to benzyl benzoate. When to seek medical advice. If symptoms do not get better or worsen after 7 days treatment with over-the-counter medications, if you experience sharp or stabbing pain on defecation, if you see blood mixed in the stools resulting it to appear tarry red or black, associated with other symptoms such as nausea or vomiting, abdominal pain, fever, and loss of appetite, and suspected drug-induced constipation. What can be done to prevent you from getting hemorrhoids? Eat food rich in fiber such as fruits, vegetables, whole grain rice, and oats. Dietary fiber can increase the weight and size of your stool and soften it, making it easier to pass. Drinking enough fluids, usually 6 to 8 glasses of water daily. Do not ignore the urge to empty your bowels, as delaying a bowel movement can make your stool harder and drier, causing you to strain. Avoid taking any medications that contain codeine as it can cause constipation. Instead, take oral pain medications such as ibuprofen or paracetamol, which can help to relieve pain. Exercise regularly and avoid sitting for a long period of time. This section is used to test your knowledge about this topic. Each question consists of a multiple choice question and there is only one correct answer from 4 choices of answer. Question 1. What are the symptoms of hemorrhoids? The answer is D. The symptoms of hemorrhoids include swelling or soreness around the anus, itching around the anal area, pain when passing a stool, a lump hanging outside the anus, bleeding after passing a stool. The blood usually appears as blood red that may clot the stool, splash around the toilet bowl or stain the toilet paper after passing a stool, mucus discharge, and feeling that the bowel has not been fully emptied after defecation. Next question, how to use the Anucare ointment? The answer is D. You can use the ointment twice daily, morning and night or after each bowel movement, ensuring area is completely covered. Last question. If symptoms do not get better or worsen after 7 days treatments with over-the-counter medications, I should? The answer is C. Consult your doctor if symptoms do not get better or worsen after 7 days treatment with over-the-counter medications, if you experience sharp or stabbing pain on defecation, if you see blood mixed in the stool resulting it to appear tarry red or black, associated with other symptoms such as nausea or vomiting, abdominal pain, fever, and loss of appetite, and suspected drug-induced constipation. That's all from me. Thank you and see you next time.